Welcome to another edition of Conversations with CASA, a monthly news blog produced by Texas CASA that examines issues and trends in the child welfare system. My name is Vicki Spriggs. I'm the CEO of Texas CASA, and we're filming at the Texas CASA office. Our guest today is Sasha Rasco. Welcome, Sasha. Thank you for joining us.
Thank you for having me.
Sasha is currently serving as the Associate Commissioner of Prevention and Early Intervention at the Department of Family and Protective Services. She took the position in August of 2013. Previously, Sasha worked 14 years regulating and supporting early childhood education and foster care, including 2 years as the Assistant Commissioner for Child Care Licensing at the Department of Family and Protective Services. Sasha has also developed programs and projects in other child and family service organizations, including the Early Childhood Intervention Program, the Texas Alliance of Children and Family Services, or Child and Family Services, and as a Governor's Policy Fellow in the Governor of Maryland's Office of Children, Youth, and Families. So you came from Maryland to Texas at some point, huh?
Well, I was born here, went there, came home.
Super. Welcome. I'm glad you came back.
Yes.
Well,
me too.
We know that in 2012, 2013, significant funding was put in place to help really build out PEI. Mm-hmm. Can you talk about what's happened, what you've done since you've been there? Because they put the money in, they hired you. I remember when you first started.
Yeah.
And a lot's happened since then. Can you talk about that?
Absolutely. I'd love talking about that. Yeah, there were so many exciting things that happened all seemingly at the same time. We had the Sunset Report that said, okay, DFPS, this prevention program has sort of just been a set of contracts. It really should have an elevated place in the agency. You had Judge Sasha come on board. He really believed in prevention. He thought the community should own it and craft it and build it. And he asked the legislature, put money in it, I will return your investment. And communities will pitch in as well. You had this growing awareness of adverse childhood experiences and the sort of public health sector joining in, but realizing that, you know, those of us already knew this, childhood really matters. It doesn't just matter while you're a child, it matters in your adulthood, it matters to your physical health. So you had this public health framework all of a sudden too, this idea that, well, let's look at disease and think of child abuse and neglect similarly. We don't just wait until people show up in the ER. That's not the only thing we do. We also think, what does somebody at risk look like, and what do they need to do? What does everybody need that could maybe prevent just these awful adversities and outcomes for children and trauma? So. And then you had the federal funding for the home visiting program and this body of evidence for programs that actually worked, because it wasn't as if people didn't want to prevent child abuse or neglect before. There's always been a motivation and an interest and a desire to do that above and instead of waiting to heal children or intervene but there was never a lot of evidence behind programs working at full scale that you could replicate easily without, crafting individual programs. And then all of a sudden we had all this evidence about programs like Nurse-Family Partnership or Parents as Teachers, and then a whole lot of other home visiting programs that could be crafted for different kinds of families and different communities. And so Judge Sasha, before the legislature even directed us, elevated our division to report to him. Then we inherited the home visiting program from HHSC. We received additional funding from the state legislature. And so when I started, we had 15 staff and about $35 million. Now we don't have a lot of staff because the program, children and families are always served by a community-based program and PEI, but we have about $105 million that we grant to communities to build the solution that works for families in their community, but guided by some standards and by a lot of training, technical assistance, and support. So it's pretty exciting what we've been able to do.
Well, I've watched the change. I remember for the longest time, for what money was going to PEI, there didn't always seem to be a lot of accountability. And there was also not a lot of attention. So I've seen how it's morphed, as you said, elevated. Judge Spisha, or Commissioner Spisha at that time, elevated it to a prominence that it needed, because we should not be waiting for a child's family to fall apart before intervening. We should be more proactive, as you said.
Right.
So that structure that's come around that, and the accountability that's been being built in, that you've really been instrumental in building into that system. So I would ask you, what do you define as your successes at this point in time? And I know you're not done, but what are the things that you're really happiest with, and what else do you want to see happen?
Yeah, I mean, that's a great question, because, obviously we want to see the families we serve do well. And we know 99% of the children that are whose parents participate in a prevention program are not abused or neglected in the first year. And then, and then we track year 2 and year 3 as well. And like in our youth, we also track whether they are adjudicated in the juvenile justice system. So we know that 95% of them are not adjudicated in the juvenile justice system, another big, complex, difficult system for kids to enter that can really change their trajectory. So we're happy about that. But that, what we would love to see is a big seismic impact on what CPS receives. We would love to alter the number of confirmed cases, or the number of kids or the severity of the cases, or the number of kids certainly being removed. And we're not yet at scale enough, to impact, I think, those big numbers, because we still are serving families through the community, through a lot of informal referral networks. It's not intentional in that it's families in front of a judge being referred, and that's partly by design, and that we want families much more upstream. So I think some of the successes beyond just the families who are, find their way to us and participate in our programs doing well, and we know that they even qualitatively, they feel more connected to their children. They feel they yell less. They feel their children are doing better. They feel they can cope more. They feel they know what resources are available in their community. All the things we want to see. But I think what we also want to see, and have put a lot of intention into, is helping communities think systemically about what do those families need in those early stages of vulnerability. And so we've lent a lot of training and technical assistance support around collective impact work. And we have San Antonio, Judge Spisha again, they've built a great coalition called Ready Kids SA. They've set benchmarks for improvement across a wide variety of metrics. This is not a new, I'm just using them as an example. Plenty of other folks have used the collective impact model, but plenty of other goals, not just that children are abused or neglected, a lesser rate, but that kids are showing up ready to learn, or food insecurity is decreased, and all of these great things we want to see kids have in their communities. But they've got their city human services department setting their budget based on those metrics. Those are the kinds of things that recognize our families in any of the stage we might see them in. Early in their, a 16-year-old mom, early, a very vulnerable, high-risk mom, or families involved in CPS, anywhere in there. They also need childcare, housing, transportation. It's not just that they need a parenting program, which is our core work, but the communities around them need to be attuned to what they need. So I think as we see communities evolve and be more connected and be more mindful, particularly of that prenatal to 3 space, where, as we know, with brain development, there's such a rich opportunity and such high risk for big costs down the line. I think that's a big success. The HOPES program, which is our own design program to give families communities, 24 Texas communities, the opportunity to build a continuum, that's been a big success to see the variety of things communities have done. You have Amarillo offering equine therapy as a way of helping families who are have trauma, cope with their trauma, because in PEI, our trauma-informed care is really about the parent. and helping them with their maybe traumatic past, so that then they are able to be attached and nurture their child. You've got Lubbock doing postpartum depression screening in the hospital and offering baby boxes. You know, you have Prematuris down in the valley. So everybody's been able to deploy resources for that really vulnerable prenatal to 3 group. And my favorite client success story right now is a mom who got off a bus in Wichita Falls, homeless, coming from a Salvation Army where she'd been kicked out, but because she got pregnant, she had both mental health and substance abuse issues, and through some public housing, she was able to get attached to the Nurse Family Partnership Program. She was pregnant with twins, which she didn't know initially, and with the help of the Nurse Family Partnership Program, which visits first-time moms starting in pregnancy every week or every 2 weeks until they're 2, that mom, by the time she graduated from that program, when her twin babies were 2, had ridden a bus for a year with those twins to save up for a car. She had an apartment, she had a job, she had breastfed those twin babies for 2 years, and was thriving. And I think, you know, that's the epitome of the kind of successes we want to see. That was a mom really vulnerable to all kinds of negative outcomes for her kiddos.
So I understand, and that's a great story, by the way. I'm just trying to think, we have a little bit of time left, but I know that you all recently updated your strategic plan, as I understand it. Can you talk about the high points of your strategic plan?
Yeah, I mean, every year we kind of highlight what we're giving a little bit more gas to, you know. And I think this year we've really realized we're kind of past the piloting phase of some of this work, and I know CASA is also statewide. You can appreciate this. It's when you start scaling, all of a sudden the implementation and the is different. It's all of a sudden you've kind of served all the families that were kind of easy to reach or kind of ready to refer, and now you're moving into serving more families, getting into those harder to reach populations, finding those front doors that families enter, scaling. We have workforce issues too. I mean, home visitors are very like our CPS caseworkers in that when they turn over, we lose clients. There's similar stresses. Nurses in particular are hard to recruit and retain, and so just a lot of those thoughts of how do we scale this? How do we embed these supports in healthcare? So that was another thing. So we really said we need to focus on the implementation science of taking prevention to scale, and in that we want to focus a lot on healthcare partnerships, and so that that's where families. That's where they go. That's where they expect to receive advice on parenting. So one exciting program that's rolling out here in Austin and also in San Antonio, Victoria, and Bastrop is another nursing model called Family Connects. But rather than it's not as much a parenting model. It's at full scale in Durham, North Carolina, where it was designed, and in that county, every baby born, their parents are offered a postpartum nurse visit 1 week or 3 weeks after the baby's born. Regardless, there's no risk categories, and it's anything from just, do you have your OBGYN visit scheduled? Do you have a way to get there? Do you need any help breastfeeding? Do you have childcare resources? How postpartum depression screening, which, as we know, crosses all socioeconomic barriers. The universality of it seems to be very appealing because it's just something, well, why wouldn't you want a nurse to come visit you? 90% of the families there say, yes, please. And then most families get just the one visit, and then there's up to 2 more visits depending on intensity, and lots of warm referrals. And the way the program is built, it's not just about those 3 touches, it's about the data, the feedback loop to the community, and the buildup of the resources that are needed based on your real-time interaction with brand new parents. So that's just another example. We've just funding a portion, like a startup, which is randomized because they do believe in universality. So it's like, I think it's St. David's is starting it off here in Austin, and I think they're going with babies born on Tuesday afternoons, you know.
Okay.
And then they're working with United Way and philanthropy like St. David's and the university and the city is a subcontractor, City of Austin, to scale it up. And that those kinds of system-wide interventions that can maybe both set a culture of we welcome babies, all parents need help, and then have kind of a triage method for getting families with higher needs help much sooner.
Super.
So that's one exciting thing on the horizon that we highlighted in our strategic plan.
Nice, nice. And just one last question. So every program like this one is not across the state yet. You want to build it up to build it out. Right. Do you have areas of the state where there are no prevention services offered? And you know, how, I'm sure it's part of your strategic plan to cover the state, I would imagine, and how do you see that happening?
Yeah, I mean, we do have areas that we certainly have areas that don't have every service. I think most of our cities, small, medium, and large, have some prevention services available, but they might not all have nurse-family partnership, or they might not all have, like our community youth development program is a zip code focused program on high juvenile crime areas, and youth has kind of positive youth opportunities. We only have that in 18 zip codes, and there's a whole lot of zip codes in Texas. So, but most programs have some programming. And we have found that the readiness of the community and the capacity of the community to provide that programming is really vital to success. And some of our highest risk communities are at our lowest stage of readiness to really successfully offer services, and engage. The families also have a lot a lot of room to feel comfortable receiving services. And so there's a lot of those things to work out at the local level and in the community culture around who would be the helper, who would be, and what does that look like in that community. But our plan to take things to scale, we're just ready to release, I wish I could have talked about this before, but a map, an interactive zip code level map that we asked UT to develop for us based on an epidemiological model. So the same way, in fact, they've done something similar with infant mortality and maternal morbidity. And anybody will be able to drill down to zip codes and see different risk criteria for 0 to 1-year-olds, 1 to 3-year-olds. We also broke it down by age because we know risk might look different for different kids. So our idea is to use that map to give communities so they can better target the resources we give them, and then to sort of take all those services to scale so that where there are the needs, we do have the mechanism for getting supports there. I think our STAR program is probably our best model of having used community-based contractors to cover the entire state. So we do have one place where we've been able to do that. One of our legacy programs, the Services to At-Risk Youth, which we're going to rename and rebrand. We've had plenty of parents tell us they're not interested in signing up their kids for an at-risk program.
The labeling, yeah.
But they love that program. But we do have 28 contractors that are available to parents throughout in any community in the state of Texas. So, and so we have a lot we have a lot of work to take home visiting that far. It's a much more expensive intervention. But
so my last question would be, if a parent wanted to access services because they knew they needed help, is there a statewide number that can connect them back to their community? How would they go about locating the service?
We don't have a phone number. We have gone back and forth about whether a hotline would really be something parents would use for that purpose or not. I know statewide intake does refer families back to our supports if they don't open an investigation. But what we do have is a website, helpandhope.org is the state-designed website for parents.
Is it spelled out, or is it the little and symbol?
It's spelled out.
Okay.
Just the letters, helpandhope.org. And it has a search by county and a search by zip code to find the organization that can offer services.
Super.
And we've done a lot of campaigning around trying to drive folks to that website and normalize parenting stress. That's what parents told us. They said, we're kind of overwhelmed, but what nobody seems to talk about is the stress of parenting. So we tried to normalize that in our campaigns. Like, they're going to drive you crazy. Kids are going to drive you crazy. It's how you handle it that matters. That's our, and so we.
Is that your tagline?
That's our tagline.
Good tagline. Good tagline. Sasha, thank you for joining us.
Thank you for having me.
And thank you for the work that you've done with prevention and early intervention, and thank you for the work that you're going to be doing. We look forward to having you back and hearing more about what's happening.
Well, thank you. I appreciate all that CASA is doing to help those kids down the road, and it'd be a great partnership. Hopefully we'll meet in the middle.
There you go. Thank you. And thank you for joining us on another edition of Conversations with CASA. We'll see you next time.